And restart when you're about to end.
Yeah, so sorry about that. And just as I was talking about the 2020 rule, so maybe the interruption was was ideal because I'd been on the laptop for a while. Yeah, so the 2020 rule says that after 20 minutes of working on your laptop, your screen, whatever, look at an object 20 feet away and close your eyes for 20 seconds. So essentially, it's to reduce digital eye strain. And it's not as if digital eye strain can per se cause any long-term complications, but it helps to make you feel comfortable and it reduces the dryness, because the other thing that happens is when we tend to work on our screens, we tend to forget to blink. So you always have to remember to blink very frequently. Sorry about that. And then I also alluded to the fact that there's been an association between short-sightedness in children and prolonged screen use, prolonged near work. So it's also important for us to try and regulate the times that our children watch TV, even read their books, and encourage them to play outside a lot as well. Okay. Now, the benefits of lifestyle modification cannot be overemphasized. If we remember, the eye is part of the body, and I said previously that certain chronic diseases like hypertension, diabetes can predispose to diabetic retinopathy and other eye conditions. So having a healthy diet with lots of leafy vegetables, vitamins, fruits, limiting alcohol use, staying well hydrated, cultivating good sleep habits, and quitting tobacco smoking will go a long way in helping us to take care of our eyes. The other thing that is really common in our environment is the belief that people have in home remedies. So we call them harmful traditional eye medication. So you find people putting substances like kerosene, urine, breast milk into their eyes. All these are no-nos, and they're very harmful. You might, in fact, if you've done it before, you've gotten away with it. That was just per chance. So it's not ideal to put anything like breast milk or kerosene. Some people even put battery water into their eyes. It's not ideal. Or some other people put herbal concoctions. All these things are no-nos. It can actually cause blindness in certain individuals. Now, as a follow-up to that, I would also like to emphasize that we should refrain from the habit of self-medicating. And because you find some people, maybe they have red eyes, they have what would call a viral conjunctivitis, and then they just get an eye drop. Oh, you were given this eye drop. They get someone else's eye drop and they start putting it into their eyes. Because there's certain eye drops, for example, like steroid drops, that can completely worsen the infection, cause the cornea to melt off, at the very extreme, cause blindness. So this is not right. You shouldn't just go and get a random eye drop and use in your eyes. If you have a specific complaints, it's ideal that you consult an eye specialist before you use any medication. Now, eye hygiene. So ideally, we shouldn't really be rubbing our eyes, but in any event, I mean, sometimes you can't help it. So hand washing before touching your eyes ensures that you don't transfer germs and dirt into your eyes. And then this is to the ladies and that you tend to share makeup or you keep makeup pencils for very long. That can also transfer germs into the eyes. And I would also want to particularly single out contact lens wearers because we have a lot of people that use contact lenses. So contact lenses are good, they're nice, at least you don't get to use glasses, but you have to be extremely hygienic about taking care of your contact lenses. Some people you use tap water to disinfect your contact lenses. It can cause devastating It can cause infections with devastating complications. You shouldn't sleep with your contact lenses either. And so these little hygiene practices helps us to remember that we have our eyes to keep and we need to keep our eyes, yes. So when do you see a doctor? I mentioned earlier that you need to do your routine eye checks, but if you're in between your appointments, if you by any chance notice any sudden changes in your vision, if you notice cloudy or blurry vision, or that you have double vision, or that even you've had this redness that is persistent, that is not going away, you have chronic itching, sudden pain or discomfort, or you've had any kind of trauma at all, you need to see your eye doctor immediately. Now, for patients that have had some sort of chemical trauma, meaning, because we get this quite a bit, some mechanics that they're working on cars and the battery explodes into their eyes, or you're doing housework and bleach gets into your eyes, it's advisable that you rinse your eyes thoroughly with tap water, and then as soon as you can, go and see the doctor so that you'll get a proper evaluation. And if need be, you'll be placed on medication. So for individuals that are already patients of the clinic, it's important that you keep your scheduled appointments. So it's not good to miss your appointments. Those appointments are given for specific reasons. Now, unfortunately, we have patients that are, no matter what we do, we can't restore their vision. They're irreversibly blind. But even for patients like this, there's hope. And so for patients like this, a lot of counseling has to go into psychological counseling, emotional counseling, and social counseling. And we have schools, we have centers, vocational training centers, secondary schools, primary schools even, and you have these schools that have been specially designed for patients that are blind or partially sighted, so that they can live as much as possible an independent life, and they'll be of use to themselves and to the society at large. So all hope is not lost, even after a person becomes irreversibly blind. But of course, we don't want to get there. That's not where we want to go to. So really, in conclusion, that's all I have to say. In conclusion, our eyes are invaluable assets. They are windows to the world. So it behoves on us to take charge of our eye health. And essentially, you're taking charge of your health, because we have to remember these eyes, we need them to see them, we need them to use them while we're here on earth. And I also need to reiterate that prevention is always better and it's always cheaper than cure. So thank you all for listening. If you have any questions, I'll be happy to take them, or if you have any comments, I'll be happy to listen to them. Thank you. So in the event of no questions or comments, I would like to say that the eye clinic at St. Emmanuel Hospital is open. So you can come in to get your eyes checked. It's always good to have at least a baseline eye check done if you've never done one before. It's always a good time to start doing your routine eye check. So you can come here Mondays, Wednesdays, and Saturdays. We're open. The optometrist will be on ground. The ophthalmologist is here on Saturdays. So